Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. You know, I always tell you that this show is really your show because you give us content matter, you ask questions, and there's been a lot of discussion because there's been a lot of advertising in newspapers and otherwise about hormonal and bioidentical products. They talk about everything from male virility to female problems and things of that nature. But, you know, I wanted to bring some experts onto the show, and that's what this show is about, what you should know about bioidentical hormones. So let me introduce to you first Dr. Andrea Ramsey. She's an integrative and family medicine practitioner here in Broward County. I believe your office is on Sunrise Boulevard, correct?
Correct.
What's the address?
It's 8320 West Sunrise Boulevard.
Okay, so now we know where it is. Right opposite Sawgrass, correct?
Close to Sawgrass.
Oh, pretty close. And it's, the group is called AssociatesMD Medical Group, correct?
Correct.
Right. And then we have Dr. Angela Pressman, who is a proud graduate of Nova Southeastern University College of Pharmacy. And she's a pharmacy slash
medical supply
partner of Box Pharmacies, and welcome to our show.
Thank you.
Good to see you again.
The same. Thank you.
Let me start with you, Dr. Ramsey. So let's talk about integrative medicine. What is integrative medicine?
So for me, I think integrative medicine, as you're saying, it's nothing necessarily new, but maybe something that's more acceptable. So even if we bring it right back to hormones, where sometimes hormones get a bad name, talking about integrative, now we have bioidentical, we have herbal supplements, we have other things that have similar properties to the estrogens, progesterones, testosterones, that might be easier to access, to have easier access to. And I think similar to what you're saying, I mean, it's in the pharmacies, it's in a lot of rejuvenation clinics. You know, I think part of it is we're trying to be a healthier nation, and, you know, where people receive their health care is not just in the doctor's offices. So in some ways, I think it's bringing the medicine and the patients back to the doctors. You know, the integrative word is not necessarily something new. It might be a new way that doctors are thinking about medicine.
Well, no, I mean, let's stay on that for a second, because really, if you think back to the formative years before there were licensed practitioners, going back to the 1800s and the 70s, all the way back, we did have a number of the individuals that were medical practitioners, in essence. They weren't licensed at the time because there were no licenses. But they were very integrative. They thought of food products. They thought of natural barks and leaves and things of that nature, which people say, well, those are for the animals, all right? No, they were really, you know, when you think of it, a lot of the original drug products
I just wanted to say
come from the earth, whether they be trees, plants, and things of that nature. So it's nothing new. It's just, it's come back.
coming back.
It's come back. So, Dr. Pressman, I know that you and Box Pharmacies for years have been leading the way, not only in integrative or bioidentical issues, not integrative, but you work with many physicians in the community. I know you do. And it's always a pleasure to walk into your pharmacies because you do such a great job in compounding products and things of that nature. So talk to me about your part of your integrative or bio, I guess you could say, hormonal issues.
What I think it's important to say about integrative medicine is that you have to look at whole body. So if somebody comes to you and said, hey, I cannot sleep, we have to find out why this person cannot sleep. Is it deficiency of hormones like progesterone or melatonin? Because melatonin, it's not just a vitamin, it's our hormone. or patient drinks a lot of coffee, exercising at night, which indirectly increase cortisol levels, maybe eating big, heavy meal full of sugar, which is giving us imbalance of glucose and insulin. So we have to answer on the question, why? What's happening to this patient? Why this patient is not sleeping? What is causing that? So when we talk about bioidentical hormones, we have to realize that cholesterol, which usually we know, hey, it's cardiovascular, my cholesterol high, it is a hormone. Insulin, we're not just talking about glucose, it's a hormone, just like as estrogen, progesterone, testosterone, DHEA. Vitamin D, it's not a vitamin, it's a hormone. So when we talk about hormones or when we talk about integrative medicine, we have to look at whole body and we have to find out why this patient have high cholesterol, why this patient has hot flashes, why this patient has low libido, why this patient cannot sleep, what is going on, and how can we fix it to bring two words together, best between vitamins, nutrients, lifestyle, and medication if patient need it. We have to change our lifestyle, which is not always easy. So we have to educate our patient and show ways pluses and ways minuses and how we can put it that together that it would be easier for a patient to adopt for lifestyle medication, lifestyle changes. Like, for example, we all want to lose weight, but nobody can lose 20 pounds in a week. It takes us 20 pounds to gain in a year, 2 years. So we have to learn how healthy way to lose this weight. As soon as we're losing weight, our metabolic syndrome going down, our blood pressure going down, we're starting sleeping better, our sleep apnea getting better, our cholesterol going down. Now even indirectly hormones start normalizing. So we have to do proper testing if we're specifically talking about bioidentical hormonal therapy. And actually, we was talking with Dr. Ramsey. When patient coming to a doctor office, we always check, oh, we have to check your cholesterol, we have to check your blood pressure. But when female coming or male coming to a doctor office, how often this female or male check for hormonal? How often that patient get checked progesterone, estrogen, estradiol, estrone, estriol, DHA, sex hormone binding globulin, LH, FSH, prolactin? How often it's done? It's very seldom, but this is the same hormones just as cholesterol, just as our insulin. So it has to be checked. When we're checking, now we know what is going on. So it's not just integrative medicine, we have to practice preventative medicine. And it's so important. So here at the pharmacy, when patients said, oh, give me something to sleep, I usually tell them to my office, I said, can you come to my office, let's sit down and you give me 3 minutes what is going on, why you cannot sleep. If I could help them to change their sleeping habits, or if I see they need specific blood work, I have to send them back to a doctor. Just like we study in pharmacy school, it has to be doctor, patient, and pharmacist. This is amazing triangle. And that's why I love to work with Dr. Ramsey, because our patient always could reach us, we always work together. And this is how I work with a lot of doctors. And this is how it's important, because now you have win-win situation. Your doctor practicing because I could sit down with this patient for 15 minutes, for half an hour, for an hour, get information what you need. I could speak with patient freely because you know pharmacist is the most trustful profession. So patients usually could sit down and talk to you freely. Then I could communicate to a doctor, and after 3 of us, we could set up a plan what patient actually needed. And this is what it's important of integrative medicine.
Dr. Ramsey, you know, I think it's interesting because, you know, healthcare itself is a major subject of the people who are the viewers. I mean, the cost of healthcare today is so high. And I'm not getting into the politics of it. It's the reality of it. The products that are dispensed on prescription are outrageously costly. But the most important thing, I think, and it was just mentioned by Dr. Pressman, is the communication that goes on between
Absolutely.
the patient and the physician. The public is looking for some help.
Yes.
That's what I hear from the people. Mm-hmm. They're looking for, how can I do it? Should I just walk in because I see something on television and I walk into a pharmacy or a supermarket or any other distribution entity for supplements? And I say, well, I saw this and maybe it's going to help me. But that's not what integrative medicine and consultation is all about. So let's talk about that.
Yeah, so I think that's a huge piece. And I think, you know, coming out of medical school, we're all into getting to the patient, making the diagnosis, giving the treatment. And part of integrative medicine is really sitting with the patient, obtaining a history, and then at a very simple level, what is it that the patient wants and what are they willing to do? If I say to a person, are you willing to be on hormones? And again, from my point of view, there might not be any family history of cancer that would make it an obvious red flag that it's a no. And the patient says, oh no, I will never be on hormones. Okay, well now I have to go down a completely different avenue. If the patient is willing to investigate, yes, we do the hormone workup. Just doing the laboratory diagnosis for that is a huge workup. Patients going to some of these outside facilities, again, might or might not do the full extensive workup that needs to be done, looking at all the different pieces. And I think from a very young part of my practice, I always had a protocol where I would go through the history, I would do the complete workup, I would make sure they had mammograms, I would make sure we did pelvic ultrasounds. You know, I also think that men somehow in there get lost. At the same time, men probably are more eager to take testosterone on an outside of the doctor's office basis. And then when they come into the office, their testosterone can be sitting in the middle, 500, 600, and their estrogen can be off the wall because it's not regulated. They are receiving things from the outside, and their primary care is not looking after things because it does take time. And you know, Angela and I have had a long-standing relationship because of that, because I might not have time to sit with every single detail, but at least I'm going to start the same laboratory investigation, diagnostic testing evaluation, looking at hormones, and then after that, even following every 3 to 4 months, or depending on how often we're making hormone changes, following the patient to really get them safe. You know, there's a big safety piece to all of this.
Well, you know, it's an interesting thing that you just pointed. And we hear some comments because people don't know. You know, again, this happened to be a very specific question that came from one of our viewers. Oh, well, you know, I went and I'm taking these products to increase my
Libido, sex drive, right?
One of the things that I've discussed with Dr. Pressman and her wonderful husband is that people often walk and they look at labels, they see something, they take it, and they never talk to the person that's highly educated, and that's the pharmacist that's there. And by the way, in Pillbox Pharmacies, the pharmacist is not far away. It's not like, you know, 50 feet away from the patient.
Very close.
And I'm not knocking anyone else, that's the way it is. But the reason I bring it up is because of the non-knowledge. You can't blame the people who are out there who are looking just for some mediation of a problem.
Absolutely.
They're trying to do something. So they come to people like Dr. Pressman or like Dr. Ramsey, and you work together and you solve their problems. Correct?
Yes, it's right. And it's very important to explain patients. You cannot just grab any bottle of vitamins, over-the-counter medication, because just like any medication, it will cause different side effects. When we talk about male enhancement vitamins, when people coming to Pillbox Pharmacy and they ask me, and they said, oh, can I take it? It will help me because it's at male support. I try to ask them, when did you go last time to your urologist? when your PSA was done last time, when doctor checked your estrogen. Why? Because our testosterone, male or female, will convert to that estrogen. And that excess estrogen will cause different side effects, just water retention, increase your blood pressure. For males, if it's not correctly aromatized, we will have breast enhancement. So we have to know all of it. And when I try to explain that patient, he like, oh no, I don't like to go to urologist. So maybe this pill, it's not for you, sir. You have to explain that to a patient, same way just like you explain about vitamin and medication. When patient on diabetic medication or cholesterol medication, all our body having CoQ10 enzyme. They must be on CoQ10. Just taking 100 milligram of CoQ10, it's not always enough. And CoQ10 helps you to normalize hormones too. So let's see what medication you're taking. Or you're on diabetic medication. We're talking about hormones. Insulin is hormone. So you're on metformin. Metformin will deplete B12. Now you're complaining you have tired, you have muscle pains. Let's see what is going on. Oh, as a pharmacist, we know that because we study that. Or you're on metformin, let's we see B12. Or I take B12 and I swallow it. We know that B12 vitamin would not absorb well in your stomach when you take it orally. Sublingual, are you drinking coffee or Coke? If you're drinking coffee or Coke, what you do? You change pH in your mouth, in your saliva. We're changing pH, now we decrease absorption. So these all things we have to know and educate our patients. That's why a lot of times I just like to stay in my vitamin aisle. They call me like a surgeon. And I just come to our patients and I ask them, do you have any questions about these vitamins? I'm a pharmacist and I will be happy to help you for free. Why? Because I believe as a pharmacist, it's my obligation to help this patient and to do that.
Dr. Ramsey, you know, again, your AssociatesMD medical group, I would assume that, that the whole integrative issue is a dominant force of the presentation of your knowledge and your healthcare beliefs. Isn't it interesting how things have changed so dramatically over the last really 5 to 10 years?
Absolutely. I'm thinking even what Dr. Pressman was saying, you know, it's the innocence sometimes of the patient, you know, coming in and they might have a medication that's cardiovascular protection, and they have something as a multivitamin, and they have something else, let's say for very specific vascular endothelial protection. And then again, my nurse says to me all the time, I ask the patient what they're taking. They had 3 medications from the pharmacy, but they had 7 supplements, right? That might be duplicating. Same thing. They're on a statin plus they're on red yeast rice. They're taking flaxseed, maybe half a teaspoon. You know, in the doses, how they come to this, in some ways very innocent, and at a very big essence, they're trying to be healthy. And like you say, medicine has come, it's completely different. What comes into the patient's hands through the pharmacy, online, they're ordering their medications, it comes to their mailbox. And now they're on 2 or 3 agents that have similar effects. Benefits we don't know. I mean, sometimes, and again, even just financially, you know, medications can be very expensive, supplements too, and they're paying and duplicating a lot of the things that they're doing, trying to be healthy.
Well, and you know, again, I think the one thing that that insurance coverage, and almost everybody has some kind of insurance coverage, although there are so many, there are, I don't know, 30-some odd million people in America who don't have any health care coverage. But the reality is that we see still today what I would call polymedical patients, especially in what I would call the mature community, which I'm a member of, where, you know, you see the podiatrist one day, the next day you see an orthopedic specialist because of knee pain, and then you see the cardiologist 5 days later, and if a woman might see an OBGYN 3 times a year, and a male might see, male or female might see a urologist. So I give the medical community a lot of credit for doing what I would call patient profiles.
What we teach our patients at Pillbox Pharmacy, try to one pharmacy and use the same pharmacy. Why? Because pharmacist already knows you. We know what medications you see, what doctors you see, what medications you take. And what we do, we actually could print out list of their medications, what they are on it, even day or couple days before when they go to a doctor office. So this way, when patient goes to a doctor, they could have a page, a list of their medications, which makes any patient's life easier because we have dosage, name, directions, which doctor wrote medication. And for doctor, it will be life easier because at one glance, they already could see everything. And this is very important.
We're down to the last 4 minutes of the show, and I know we got so much to talk about. But Dr. Ramsey, I really want to focus on, again, integrative medicine. You already told us what it is, but I want you to know, I want you to tell these people the value of integrative medicine.
You know, I can come up with maybe some fancy way to talk about the medicine itself, integrative medicine. And again, in some ways, it's the same medicine that we've practiced all these years. We might have named it a little bit differently. I think for me, integrative medicine is as simple as me talking to you and really coming to a one-on-one understanding who you are, what your life has entailed, what your medical ailments might be, what medicines you're taking, you know, it's the whole package. And again, in some ways, that is integrative. When we come to the how to treat that, and again, I use traditional medicine, I use supplements. It's the whole piece, the package, and again, at a very simple level, one-on-one. So I think that has helped me understand it because otherwise, it is very vast, it is very immense. How do you capture all of that? It's hard, but when you bring it right back down to one patient, it's very simple. And even with time constraints, with insurance, whatever it is, you know, it's building it piece by piece. We start with something today, we work with dietary modifications, we come back, we see what works, what doesn't work, and then we go at it again. That, I believe for me, it's a constant love of what I'm doing and being willing to integrate your lifestyle with what I've written with what maybe you bring in from a pharmacist someplace else to help your energy level. It's the whole package. I can't close my eyes and say, oh no, that's not a prescription. What are you doing over there? I can't take care of you. You're doing something outside of what I prescribed. I can't trust you even as a patient. So it really is a very, I believe, intimate working relationship with the patient. That's what makes it work.
Thank you.
Yeah.
And Dr. Pressman, I certainly know, at least I know where one of your pharmacies is because it's only about a quarter of a mile away from my home. The Pillbox Pharmacy in Pembroke Pines, which is the home base.
Yes, Taft and Flamingo, yeah.
I mean, you got multiple pharmacies around. That's because your husband is an entrepreneur.
Yes.
And I know that he's lucky to have you because you have the knowledge. Oh, he's got knowledge too, but you got real knowledge because we taught you so much here.
It's true.
But I will tell you this, that I want to congratulate both of you because you're not on the cutting edge. You are on the playing field of what I would call preventative and good monitoring of health of the individuals in our community. And I think the people that have asked us questions really want to have, don't forget, we have more people over the age of 70 numbers of any state in the union. We have, percentage-wise, we have the highest number of people over the age of 80 of any state in the union. But all they want is they want a respectful, useful life in front of them. And there's so much that both of you do to help them. Now, I know there are a lot of younger people that are watching, but I really think that if people would just allow themselves to accept the knowledge of people such as Dr. Pressman and you, Dr. Ramsey, it would make their lives a lot more pleasant. We didn't even touch on the issue of making sure you drink a lot of water and things of that nature, which I know is a very big thing. So I'll tell everybody, they both believe that you got to drink how much water in a day?
Half of your weight.
Okay, wow, that's a lot of water. But you know, I mean, you must tell your patients that. So I leave that at the end of this show. But I want to thank you both for being here. I know some people would say, what are they really doing? I mean, I've been going to the same doctor for the last 20 years, and they're about to retire. But there's no such thing as retiring good health.
True.
Correct?
So true,
Absolutely.
yes, sir.
Good health is always new knowledge. And knowledge is the greatest power you can get in providing good health for yourselves.
It's true.
So all I can say to thank you very much, Dr. Ramsey, for being
My
here.
pleasure.
Dr. Pressman, thank you
Thank
very
you.
much. Say hello to your husband.
I will.
Good pharmacist, by the way.
Yes.
And,
Me too.
I just want to say to the people out there, I always tell you to take good care of yourself. I think you heard today that your information is so valuable to Dr. Ramsey and her practice, and Dr. Pressman and her pharmacy practice, because they can't know what you're taking. They can't communicate with you unless you're willing to communicate with them.
Yes.
big
So please take good care of yourself. And remember, this show is called Dateline Health. My name is Fred Lippman. We come to you from Nova Southeastern University. Until next time, see you.